Please welcome Eddie Burns, Senior Fire Chief, Dallas Fire and Rescue.
Good morning, and welcome to the great city of Dallas, Texas. I know you've been here a couple of days and you saw some of the restaurants, some of the sites. I know it's all in your brochures, but today I want to talk about Dallas Fire Rescue Department. I want to thank the sponsors, first of all, and all the vendors, and especially all the Dallas Fire Rescue members that have helped with the conference. Dallas Fire Rescue's commitment to EMS began in November 1972. After officially assuming the service from the funeral homes, the EMS division started with 16 ambulances, riding with 2 EMTs. In 1974, the system began using 1 paramedic and 1 EMT. We became a total paramedic service riding with 2 paramedics in 1976. Today, our EMS service has grown to over 800 paramedics, serving 1.3 million citizens in over 380 square miles. DFR, Dallas Fire Rescue, is one of the largest fire-based EMS services in the United States. With 45 ALS vehicles, DFR responds to 180 calls annually. This dual paramedic fire-based system offers some of the most outstanding care available in the EMS world. DFR is under the medical direction of Dr. Paul Pepe, who you'll hear later, chairman of the Division of Emergency Medicine at the University of Texas Southwestern Medical Center. Dr. Pepe is one of the giants in the field of pre-hospital emergency care. A legendary academic and researcher in pre-hospital emergency care, Dr. Pepe has assembled a staff of EMS physicians who provide direct 24/7 oversight of the clinical practice of pre-hospital emergency care by the Dallas Fire Rescue clinical providers. Let us not forget, as you saw our fellow EMS, in memory of those, what our passion, what our purpose is, our mission is. See, the greatest compensation that each of us receives is the privilege of being identified as a member of this great organization. The superior reputation of your organization is on loan to you. We are its caretakers. Each of us shares in the responsibility to preserve this reputation. You have one of the most difficult and demanding challenges as public safety officers. Saving lives, yes, it's your passion. It separates you from the ordinary worker. I ask you today, what makes great EMS providers? I want you to take that away with you today, and I want you to go back to your organizations, go back to your communities. I want you to find out what makes great, not mediocrity, but what makes great EMS providers. I hope every one of you have a takeaway while you're here in the city of Dallas. I hope something that is said, done, that ignites a fire within you to make our cities, our medical communities, our fire departments better prepared to meet the challenges in emergency medicine and patient care. Take care, have a great time in our city, learn a lot, attend your classes, support our sponsors, and more importantly, be safe. Thank you.
Please welcome Scott Cravens, publisher of EMS Magazine and EMSResponder.com.
There we go. All right. Welcome, and thank you for coming. Thank you for finding your way here. I know to this room. I know it could be a little confusing. Reminds me of the 911 call that went like this. 911 operator, 911, what's the nature of your emergency, please? Woman, I'm trying to reach 911, but my phone doesn't have an 11 on it. This is 911. Oh, I thought you just said it was 911. Yes, ma'am, 911 and 911 are the same thing. Woman, honey, I may be old, but I'm not stupid. All right. Next, before we go on, I've got a quick video announcement, so if we could roll that video. So EMS Magazine, EMSWorld.com, and EMS Expo will now be under one name, and that is EMS World. You can find us at EMSWorld.com, and EMS Magazine, starting with this October issue, is now EMS World Magazine. And starting next year, it will be EMS World Expo. So thank you for your support, and we hope to better serve you, bring you more information under this new brand, and hopefully that is one place now that you can go for all your EMS needs. All right. For the video, there was a couple of pictures on there, one being from the EMS bike ride that I participate in each year, and that's probably one of the most rewarding things that I do. I would encourage people to check that out. They're adding new trips to that, but it's wonderful and yet poignant at times, because we sometimes ride into an agency where there's been a recent line of duty death. Emotions are a little raw, a lot raw in some cases, but they appreciate the attention that we're giving them and the sentiment. So they also have a booth in the exhibit hall, so I encourage you to check that out. Last year there were over 100 riders just on the New York to D.C., actually started up in Vermont, down to New York and to D.C. And Steve Barry, the cartoonist and presenter this week, is a regular rider. He is there. And I tell you what, you really get to know a person when you ride with them for 7 days and several hundred miles. And I tell you what, there is some underwear that a grown man shouldn't wear. Just kidding. I didn't get to know Steve that well. And don't tell him I said that, because one of his favorite phrases is, you know, Scott, there isn't anything I'm not afraid to draw. So be careful if you're going to his site or his session. But do check him out. Check out the other speakers that we have from across the country. We know that all of you make a sacrifice to be here. We know many of you are paying out of your own pocket, at least some of your expenses, if not all. And so what we try and do is stack the deck here with speakers from across the nation, the best speakers from across the nation, with the most important information for you, starting with Paul Pepe this morning. In addition, we have the largest EMS exhibit hall in North America, and what that means to you is that a lot of these exhibitors come to this show to launch new products or changes to their products, because they know they're going to get a big crowd here. So I encourage you to definitely go and check that out. You can go there right after this opening. There's food there, so you can kill two birds with one stone. There's also bathrooms, and that becomes more and more important to me as I get older. So I stake those out ahead of time so you're covered. So you can go there and take care of all your business. Also stop by the EMS Expo booth. We're going to be giving out a limited number of digital cameras there, so you can take pictures of your EMS world and then hopefully send those in, and you'll get more information there. Okay, we're going to move on to the awards now, starting with the Robert Nixon Awards. EMS World Magazine is proud to announce the 2010 winners of the Robert Nixon Scholarship. Throughout his 30-year EMS career, Bob dedicated himself to educating EMS professionals and served on EMS Magazine's editorial board for many years. The scholarship was created in his memory by Bob's family to provide access to educational opportunities for deserving EMS professionals. Will Joshua and Leanne please come up? Our first recipient is Joshua Holloman. Joshua is a training officer for Johnson County, North Carolina. He entered EMS as a cadet at age 15. After high school, he obtained an Associate of Applied Science degree and became a state-certified paramedic at age 19. After graduation, he began working full-time for Johnson County and continued his education at Western Carolina University. Josh graduated from WCU in 2007 with a BS degree and is currently in his final semester of the Masters of Health Science program. In July 2008, he became EMS training officer in the system where he got his start. Leanne DeCook is our second recipient. Leanne is an EMR with volunteer service in Alberta, Canada, where her husband also works as an EMT in the rural area where they live. There aren't many opportunities for continuing education, so DeCook and her husband read everything EMS related they can get their hands on and plan to take back as much information as possible from this conference to share with their coworkers. Next January, DeCook hopes to attend EMT school and eventually become a paramedic. Let's congratulations. Okay, our first service award is the Volunteer EMS Service of the Year Gold Award, sponsored by Firecom. Will Dan Byron please come up? Is he in here? Also, I'd like to have Linda, Larry, Mark, Dave, and Andy come up. The Morris Minutemen and women have provided superior emergency care to the residents of Morris Township and Morris Plains, New Jersey since 1941. In addition to serving a population of approximately 27,000, the Minutemen and women provide mutual aid to 7 adjacent towns and beyond, and medical services to a high number of county facilities, including 2 correctional facilities, a youth shelter, a county public safety training center, numerous parks and recreation areas, 5 elder nursing facilities, a homeless shelter, 3 ice rinks, a battered women's shelter, numerous schools and colleges, and multiple corporate headquarters. They also cover 2 high-capacity commuter train stations and the Morris Township Airport. Last year, the Minutemen completed an effort to meet and exceed all OSHA safety training and equipment requirements and was certified by an OSHA inspector as fully compliant. According to Tiffany Wilshaw, who nominated her squad for the Gold Award, when you look at our walls and see photos of past active members and old Cadillac Packard ambulances, then go to our meetings and hear examples of leadership, dedication, and skill our members demonstrate on a regular basis, it's easy to see that we are not only continuing our 69-year tradition of excellence, but we're progressing into the future. You can read more about the Morris Minutemen in the October issue of EMS Magazine, but please join us now in congratulating them on their award.
This is a great honor for us and our organization, and we're very proud to be here. Thank you so much.
Our next award is the Dick Furneaux Paid EMS Service of the Year Award, sponsored by Furneaux. So I invite L.B. Borgraff, if he's in the room, to come on up. And will Don Lundy and his team come up to the stage, please? Charleston County, South Carolina EMS might not be one of the largest agencies in the country, but it's certainly one of the busiest and most progressive. With a staff of 144, the agency provides service to the entire county's population of 315,000, covering 1,100 square miles. Some noteworthy innovations in pre-hospital care and development include development of a tri-county multi-hospital committee involving 3 governments and 4 different hospitals to improve cardiac care, development of the first RSI program in the state, a student exchange that allows paramedic students from Britain to come to the U.S. for the ride time, a grant-funded medical Spanish course, and an incident command school. CCEMS employees are heavily involved in the workings of the agency, as evidenced by employee-designed ambulances, an employee-developed field officer training program, and development of medical and trauma protocols. And the importance of CCEMS employees to their employer is reinforced daily through worker safety and well-being programs. For its outstanding work in back injury prevention, CCEMS received the National Association of Counties Achievement Award in Risk Management for Strain Injury Reduction after the department reduced workers' compensation costs by over $1 million. In spite of its successes, Charleston County EMS occasionally struggles like everyone else, says EMS Director Don Lundy. Even though we all try to do the best we can do every day, it's always great once in a while for somebody outside the circle to say, "Yep, you've got it." Congratulations to Charleston County.
Well, you can tell that this couldn't be done without these fantastic people behind me and the 139 that I work with every day. They're awesome folks. I want to thank Cygnus for this wonderful award. Frankly, we haven't done any work administratively for the last 3 weeks. So these guys have been doing all the work and saving all the lives. I have to say before we leave, just to know who's here, I know that a lot of times you see the chiefs and sub-chiefs here. This is the working force. It includes Mary Coyne. She's the logistics coordinator. Without her, we wouldn't have a Band-Aid to our name. She makes sure we have everything in the house, and when we don't and we forget, she yells at us to make sure we get it. Juanita Mitchell's a trainee who started as a trainee, is now one of my best EMTs, going to be one of my best employees here, a very caring individual. Pete Levine is a paramedic who, when our director died this year, asked me if anybody was watching his house during the funeral and volunteered to do that. Seth Toth came to us as an EMT, went through paramedic school, is doing an awesome job with us. Kim Wynn is our paramedic of the year, and I forgot to mention Juanita is our EMT of the year. Those are chosen by the employees. Lieutenant Stacy Crossman pulled a woman from a burning car one day, returning from a staff meeting that she wasn't supposed to be at, but she came to anyhow because she wanted to. Captain Jim Ciali became my acting operations manager when my operations manager suddenly retired to a medical disability. Captain Todd McGeorge is the one that does all the training. Without him, we wouldn't know a thing to do. Last but not least, Major Donna Can. She has been with the service 36 years, and this month surpassed 3,000 hours of saved sick time. This is just 9 of the 137 people that we have here. They are awesome. They are the reason we have this. I thank them very much, and I thank you, and I thank Cygnus.
Okay, and now I'd like to invite Mike Touchstone from the NEMSMA Board of Directors. That's the National EMS Managers Association, to come and present the Executive of the Year Award.
Good morning. I'm honored to be here this morning to present the first annual National EMS Management Association Award for the EMS Executive of the Year. This award, sponsored by NASCO, recognizes an outstanding EMS executive, chief officer, or director who has made significant contributions to his own agency and to EMS in general. This year's recipient rose above a very strong group of highly qualified nominees. He's held positions in Austin, Fort Worth, Corpus Christi, and was the Assistant State EMS Director for the Texas Department of Health Bureau of Emergency Management. He served with Austin Travis County Emergency Medical Services Department since 2006 and was appointed their director in 2008. He is very active in leadership development, improving management practices for EMS, and has been instrumental in maintaining and improving the reputation of Austin Travis County EMS as an industry leader. Congratulations to Director Ernesto, aka Ernie, Rodriguez, the 2010 EMS Executive of the Year.
Don't take that to the bank, though. They may not cash that. Okay. And now I would like to introduce my good friend and fellow crime fighter, Pat Moore, President of the National Association of Emergency Medical Technicians.
Thank you, I think, Scott. Yeah, we were in LA together and had a good time, but Scott, do you know the difference between a Yankee and a damn Yankee? Okay, well, I'm gonna tell you. A Yankee is one that comes down here in the South, visits a while and goes back. A damn Yankee is one that comes down here and stays. You're headed back, right? Oh, thank you. And on behalf of the Board of Directors of the National Association of Emergency Medical Technicians, it's my pleasure to welcome you to this year's EMS Expo in Dallas. As the only national organization that represents the professional interest of all EMS practitioners, NAMT is proud to serve as a partner of this great conference. Please come to visit us in booth 1215 in the exhibit hall. We're holding a silent auction in the adjoining booth, number 1216, and there's lots of products there that have been donated by the exhibitors here at the conference, and we hope that you'll come and bid on those products, because the proceeds of those bids and the winning bidder will go to the NAMT Foundation to fund scholarships for EMTs and paramedics. I've also been instructed to remind you about the party at Eddie Dean's Ranch tomorrow night. What time does that start? 6:30, and I assume that there will be plenty of opportunities for you to purchase those tickets here at the exhibit hall, the conference, the registration desk, and maybe even over there. Okay. It's now my honor to present to you this year's recipients of the EMT and Paramedic of the Year Awards. The 2010 NAMT EMT of the Year Award is sponsored by Braun Industries, and I'd like to ask Chad Brown to come to the podium to help me present this award. There he is. I'm pleased to announce that Mark E. Wintle of Morris Township, New Jersey, has been selected as this year's EMT of the Year. Mark is an EMT basic and captain of the Morris Minutemen Emergency Medical Services. He joined this service in 2003 and since then has become one of the pillars of the organization. Mark is a true leader who strives to help his community and his state by making his squad become the best they can be by being the best he can be. Mark is one of the most active members of his service. As a strong proponent of disaster preparedness, he incorporated the incident command system into his service's planning and was involved with the group's transition to electronic charting this year, learning and personalizing the system and training others. Mark is also involved in the Morris County Captains Alliance, the Southeast Morris Rehabilitation Action Coalition, of which he is a founding member, the local hospital association, and the New Jersey EMS Task Force, helping at large-scale incident drills and public events. He served as the county strike team leader and has been instrumental in creating a new Morris County EMS response force. Please join me in congratulating our 2010 EMT of the Year, Mark Wintle.
Thank you. This is a huge honor. I really love EMS, and I'm humbled by this. Thank you.
Our next award is the NAMT Paramedic of the Year, sponsored by Massimo. Bob Owen, will you join me to present the award? I'm pleased to announce that Lisa M. Camp of Friendswood, Texas, is our 2010 Paramedic of the Year. Lisa serves as EMS Chief of Friendswood Volunteer EMS. Lisa is a dedicated supporter of the citizens of Friendswood, the state of Texas, and the country through her leadership in quality pre-hospital patient care and community-wide emergency response. Lisa has been a clear leader in the areas of patient care, medical control, disaster preparedness, and public education and training. On behalf of her community, Lisa has proactively prepared for the possibilities of disaster by participating in and sponsoring conferences and drills in disaster management, acquiring specialized antidote kits, and training her service to the use of Level C personal protective equipment. After the events of September 11, 2001, Lisa joined the Texas 3 DMAT team, where she fills a vital leadership role. As part of her position with the DMAT, she deployed to New Orleans for several weeks after Hurricane Katrina. Raised in a fire EMS family, Lisa has been active in EMS and fire response since she became old enough to join Friendswood Volunteer EMS and Volunteer Fire Department. She worked through the ranks to become the EMS Chief in 1995. Lisa has received numerous local awards and received the Volunteer EMS Provider Award from the Texas Department of State Health Services. Please join me in welcoming to the podium our 2010 Paramedic of the Year, Lisa Camp.
Truly, this is the pinnacle of my career, receiving this award, and I want to thank the NAMT and Massimo for sponsoring this. And to my friends, family, colleagues, and all those that my students, you inspire me every day to do this, and I thank you.
And now it's my distinct honor to introduce you to our keynote speakers. Dr. Jane Wigginton is an assistant professor of surgery, emergency medicine, and a clinical scholar in the Department of Clinical Sciences at the University of Texas Southwestern Medical Center and the Parkland Health and Hospital System. She is also assistant medical director for resuscitation research at Dallas Metropolitan Biotel System in Dallas. Dr. Paul Pepe is professor of medicine, surgery, pediatrics, public health, and Riggs Family Chair in emergency medicine at the University of Texas Southwestern Medical Center and the Parkland Health and Hospital System in Dallas. He is also director of the City of Dallas Emergency Medical Services for Public Safety, Public Health, and Homeland Security. Medical Director for Dallas Metropolitan Medical Response System for Counterterrorism and Disaster Mitigation and the Dallas Metropolitan Area Biotel System of Dallas, and an emergency medicine and trauma consultant for the White House Medical Unit in Washington, D.C. Renowned for a grassroots, streetwise style in planning, implementing and overseeing a systems approach to saving lives, both operationally and through clinical trials, Dr. Pepe's programs have resulted in some of the highest cardiac arrest and trauma survival rates worldwide. Ladies and gentlemen, please welcome Drs. Jane Wigginton and Paul Pepe.